This is Bianca Martinez, and I'm going to be doing my video involving the IM injection and insulin injection and the subcutaneous. I'm going to begin by doing the IM injection first. We are going to begin by confirming in the patient's MAR that it has been ordered by their physician to receive an injection, and the medications that they receive, it can vary in what kind of injection you're going to use. So for this one, we're going to use an IM injection. Once you have confirmed that it's in the patient's record, you're going to go ahead and prepare the medication that goes in the syringe at the Pyxis before you head into the patient's room. Now that we're going to go ahead and head into the patient's room, begin by knocking on the door, hand hygiene, introducing yourself to the patient, letting them know that you're going to be the nurse today and that you're going to be giving them an iron injection. Hi, my name is Bianca, and I'm here to give you an injection that your doctor has requested for us to do. Then you're going to begin by confirming the patient's name and date of birth. You can have them state it and at the same time looking at their medical band. Once they have confirmed their information, we are going to go ahead and begin by having the equipment ready. You can set it up on their table, clear of anything, having the injection prepared with the medication, an alcohol swab to clean the area that you're going to give it. We're going to go ahead and say we're going to give the IM injection on the patient's arm. I am now going to put on a pair of gloves, clean gloves. Opening the alcohol swab, cleaning the site on the patient's arm, and you want to make sure you clean the arm thoroughly. Dispose of that in the garbage. It's also important to wait for the area to dry. Try not to fan it just to prevent any particles from going on that site. Have your injection ready. Being careful on how you take off the safety, the cap of the needle. When administering the injection, you want to make sure that the bevel is up. It's kind of difficult to show you on the video. Once the area has dried, we are going to now administer the injection going at a 90-degree angle, slightly holding onto the arm. Here we go. 1, 2, 3. Pull out. And safety. Once you have put on the safety on the needle to prevent any accidental pokes, you're going to go ahead and dispose of it into the sharps container. Removing the gloves. I am going to go ahead and leave my gloves on since we're going to do additional videos. So that is the process of getting an iron injection. Now to administer a subcutaneous injection, it is the same steps, confirming that the physician has ordered for them to receive an injection subcutaneously. Like I said, many times it depends on what kind of medication and how they want it delivered, depending on how far into the muscle the medication is going to go into. You're going to have your injection ready with the medication as you head into the patient's room. Begin by knocking on the door, introducing yourself, letting the patient know that you're here to give them an injection, and also mention that it's going to be given subcutaneously. Subcutaneously, the needle is smaller and it goes at a 30 to 45 degree angle. For example, right now, I recently started administering B12 injections to my son that go into the buttocks that go at a 30 to 45 degree angle, which at some point can be difficult for a smaller child because they tend to move, so you have to have somebody holding them down. And here we're going to go ahead and begin by cleaning the area. Let's say if it's the buttocks, you're going to clean the area clean of where you're going to administer the injection. Waiting for that area to dry. Try not to air fan it. As you wait, You're going to go ahead and remove the cap of the needle. Once you have noticed the area has dried, getting a little bit closer to the patient, that way you would be able to see to ensure it's going at a 30 to 45 degree angle. I like to grab the area and with the bevel again, making sure the bevel is up as you inject. Going really quick, 1, 2, 3, at a 30 to 45 degree angle. Remove the injection, putting the safety on once the injection is complete to ensure there is no accidental pokes, and dispose of the needle into the sharps container, removing the glove, documenting that you just administered the subcutaneous injection to the patient. Lastly, for the insulin injection, it is similar. The needle is similar to a subcutaneous one. The main difference is how you're going to administer it and where. Some physicians prefer the arm, where many people are told by their physician to do on their, they can do it on their side of their stomachs, but not 1 or 2 inches close to their belly button. You want to stay away from it, preferably choosing the sides. Also, when administering the insulin injection, if they are a heavier patient, you want to make sure you're grabbing a good amount of skin to ensure that the insulin is going as close into it as possible. So like any medication, you're going to make sure it is ordered into the patient's chart by their provider. Once you confirm that it is, you're going to have that medication ready before you head into that patient's room. You're going to go ahead and begin by heading to the patient's room, knocking on that door. I just realized I forgot to mention in the 2 previous injections, you're going to close the curtain to provide privacy, even though they may be in a single room. After you close our curtain to provide privacy, you're going to introduce yourself as the nurse, that you're here to give them their insulin injection that their provider has ordered. Before doing so, you want to identify the patient using 2 different identifiers, being their name and date of birth, having that patient state it, and while at that same time confirming on their medical band. Once you confirm that we have the correct patient, we are going to go and begin by letting them know we're going to give their insulin injection on their side of their stomach. So you're going to have them lay down, turn on the side, clean the area you're going to administer the injection, waiting for it to dry. Sometimes if you do go in too early, it is possible that you are going to put the needle in and they might feel that sting even more because of the alcohol swab. Once it has dried, you can remove the cap very carefully. Having the insulin ready. Okay. Like I said, for example, if it is a bigger patient, you're going to want to grab 1 or 2 inches of the skin, going at a 90 degree angle. 1, 2, here we go. Remove it carefully and putting the safety on. Try using the 1-hand method to prevent any accidental pokes. Once you have secured your needle, you're going to go ahead and dispose of it to the sharps container. Now I'm going to properly show you how to remove my gloves. Hand hygiene, confirming with the patient that there's nothing else. If they need anything else, to let them know, putting the car light in reach. And that is it for my injection videos.